It's all about acne tonight, and yeah, what causes it? What sort of types of conditions affect it? What does it look like? I know we all know a lot about what acne looks like, but yeah, I'm just going to just generally sort of jabber away, and please feel free to ask any questions that you want to ask. Say it's been a while since I've done a live for various reasons some of you will know about, and yeah, I'm just really glad to be back here and actually sharing some of my knowledge with you guys tonight. So yeah, what causes acne? Well, let's talk a little bit about statistics. So literally about 80% of people at some point in their lives actually get diagnosed with acne, which is it's a really high number, isn't it? And it's not just down to teenagers, actually affects adults as well. And it seems to be more prevalent in adults now. So yeah, and it causes so many things. It causes depression, a loss of confidence, body dysmorphia. It can even lead to suicide. So I think it's a really important subject for us to touch on, and hopefully I can just try and help point in the direction of some of the things. And I'm going to keep it really generalised. This isn't a way to promote everyone to come into our clinic. This is just to hopefully give you some solutions that you can research and look at. And as I say, please do try and ask any questions that I'm not sure, as I say, whether they're coming up on. Oh, I can see some comments here. Thank you. Hi, Anita, and hi, Maria. So, yeah, great. Actually, this actually works better than my phone. So I must do this more often. So, yeah, thank you for coming along online tonight and watching. So let's start with what causes acne. And I'm sorry if I keep glancing away. I have got some notes. So, I'm not just going to ad-lib it completely. So I will be just referring to things and just making sure I haven't actually missed anything. So, but the main thing that does cause acne is hormones. It's the biggest thing out. And this actually has an effect to actually make the oil in our skin just overproduce, because the glands that produce the oil in the skin are affected by these powerful chemical messengers. So it's just, and in acne, these chemical messages are really super sensitive to the normal levels of the hormones, causing them just to produce too much oil. So just a really interesting fact for you guys out there as well, because I know a lot of people get really confused by this, that a blackhead is not dirt. A blackhead is actually a plug of oil, and the black colour is actually a chemical reaction of the oil with the air. So that's how it works. So don't just think that you've got dirt, and I think some people, they just want to over exfoliate. They want to scrub at their skin all the time, and that is really detrimental. Maria, who is watching, is actually a cornea therapist, and she will absolutely tell people off for over exfoliating their skin. And it is so true, because the top layer of our skin is there for a reason, and it is there to protect. And okay, yes, we don't want all the dead skin getting in, so we do want to gently exfoliate, but we don't want to over exfoliate. And that's what a lot of people with acne can actually do. They just tend to scrub, and they use these really harsh products and things on the supermarket shelves that just tend to just really be very alkaline, strip the skin back. And then actually what happens is the skin actually has to overproduce oil, and you actually get a worse acneic condition. So that's the first tip that I can really give you guys, is not to over exfoliate, not to use some of these brands on the supermarket. And I'm not going to start pinpointing brand names here, but actually not to just to go and use some of these really harsh, how they're promoted for clearing the skin for acne, because they are just far too alkaline for the skin. Our skin is naturally slightly acid. We need to maintain that acid mantle and that acid barrier to our skin to offer protection for the bacteria as well. So the bacteria that actually usually live on our skin is actually usually normally really harmless. They don't cause any problems. But obviously with people with acne, it actually causes this this environment for the bacteria to actually spread and to grow, and it actually leads to inflammation and to pus-filled spots. And that's actually what happens. So what types of conditions, let's talk about this, that actually affect our hormones and therefore can lead to acne. So the main ones here are things like medications, so contraceptives, steroids, those types of medications, diet, certain medical conditions, things like polycystic ovary syndrome, menopause, a big one, especially obviously in the older ladies, and genetics, stress. Actually, some skincare products and makeup, they can definitely aggravate it as well, and smoking. All those types of things that, you know, are obviously detrimental to our skin in the first place. In adolescence, acne tends to typically appear on the T-zone. And so the T-zone being across the forehead, down the nose and the chin. But in adults, it actually typically presents on the chin area. So if you see those spots that are presenting on the chin, it's often hormonal in adults as well. And the other thing is it's actually graded according to severity. So in a grade 1, it might just be a typical mix of blackheads and whiteheads and that type of, you know, sort of just a few pimples and spots, going up to grade sort of 5, which is deep cysts and nodules. And to be honest, if it gets the deep cysts and nodules, that's probably when we do have to actually look at medical intervention. But there are lots of things that we can do without necessarily you having to go running off to the doctor and actually having medical intervention, because some of the treatments can be really, really harsh and they can thin the skin as well. So do look to a skincare professional as your first port of call, but sometimes if they are deep cysts and nodules because of infections that are in the skin, then we do have to look to actually refer you over. And obviously we're not going to treat things that we're out of our depth with. But let's talk about ingredients. We are going to look at ingredients in skincare. So we're going to look at tea tree oil, and we're going to, that's a very sort of, sorry, I got distracted a little bit with some questions there. So Maria actually mentioned leaky gut, and actually, yeah, I missed that. Thank you, Maria. Leaky gut is really important actually, and I should have mentioned that one. So thank you. And this, anything to do with the gut, so it's all about gut health, what we put in, and making sure that we've got a really, really good balance. And that's when we look at things like probiotics and what have you. Anita's asking about muscne. And this is obviously a big subject that has, obviously over the last year, has been talked about a lot. I wrote something up about this actually on my page last week. And muscne is an interesting one, and it doesn't happen to everybody, but it does happen to quite a few people. And it's when obviously the bacteria can get trapped underneath your mask, and it's when it's not changed regularly enough. Makeup can be a bit of a cause as well, because obviously the chemicals, if they're in the makeup, can tend to just block everything is the only way to describe it. It just ends up getting all congested. And as I say, obviously bacteria getting underneath. One of the biggest things I can say with muscne is to change your mask really regularly. I think that's a biggie. And again, some gentle exfoliation. I have some really, really good results with some mild lactic acids and things like that on muscne, because it just helps to gently keep it, and just keep it clean. Just keep it clean. You know, it's so important just to make sure that the skin is clean and washed and cleansed all the time. Not washed, let's not wash, not with soap anyway. Let's just keep it with some really nice mild cleansers that are pH balanced to the skin as well. So yeah, it's just another topic in itself, muscne. It's an interesting one. So ingredients to look out for in skincare, we've got tea tree oil. It's a really popular ingredient, and it really can help. It wouldn't necessarily be my first port of call, but I think it's when it's included alongside some other ingredients, then I think it can be a really, really nice one as well. And the great thing about tea tree oil is that you can spot treat as well. It's a really good anti-inflammatory, it's good antibactericidal, but do always patch test it on the inside of your arms, just so you don't experience any irritations, because it can be quite irritating on some sorts of skin. And to be honest, I must admit, I don't particularly like the smell, but that's a personal thing. Some people love it because it smells quite medical, but it's not my favourite. But it's not about smell, it's about actually sorting your skin out. It's also, it's also important to dilute it in some sort of carrier oil. So coconut, jojoba, almond, and you can put 1 or 2 drops of tea tree to every 12 drops of carrier, something like that, you know, just to make sure that you're not using it too strong on the skin. My favourite are acids. As I say, we don't talk about over exfoliating here, but we do need some acids to get deep inside the pores to actually deep cleanse and sterilise within the skin. So you've got your alpha hydroxy acids, but my favourite on acne would be beta hydroxy acids. They work really deeper, much deeper inside the pores. They're oil soluble as well, and they aren't actually aggressive. They can actually really calm the skin. So one of the main BHAs, beta hydroxy acids, that we hear about is salicylic acid, and it can be really effective. But again, please use it in the hands of a skincare professional. I can't stress that enough actually with acids. I wouldn't really go buying these off a shelf. We had a client who visited us not for acne actually, but for pigmentation issues, who had decided to take it upon himself with a coloured skin to actually use salicylic acid on his skin and managed to give himself hyperpigmentation. So I can't stress enough that there's some really, really harsh ingredients out there, and it's really important that you use it with the correct advice. Green tea is another one. It's fantastic for decreasing inflammation in the body. So this actually can be by drinking it, but you can find it in some topical skincare products as well, but do look for ones that contain at least 2%. It will work a lot more effectively. One of the most awesome ingredients I think has been, and actually we've talked about this quite a lot more, it seems to have come out more in recent times, is niacinamide, and it's an awesome ingredient that actually helps to build the cells in the skin and prevent environmental stresses, including UV, sort of pollution, toxins and things like that. So it's really helpful on acne, particularly if it's inflamed. Really helps to improve the skin texture and actually reducing the lesions that are there on the skin. So you can look for niacinamide in a product and you should hopefully get some really nice results. The biggie as well is always retinol, vitamin A. And again, this is another blog all by itself, like Maskne really. We can talk about this one a lot. But the wonders of vitamin A and retinol, it's just, I love it. It's just, I love it for all types of skin conditions, because vitamin A is the skin normalizer. It actually acts directly on the cell DNA. So it will actually help to normalize skin by repairing the cell DNA. So then you get this chain reaction of really nice, healthy cells going on throughout. So it actually, contrary to belief where people think that it actually really thins the skin, can actually really help to thicken the skin by releasing growth factors. It actually helps to heal the skin much quicker, and it does increase the shedding of dead skin cells, but it doesn't actually really thin the skin, especially again if it's used with the help of a skincare professional. It can really help to restore the skin to normal. I want to just touch a little bit as well on the link between diet and acne. I think again it's so important. We've touched on with leaky gut, which Maria pointed out, thank you. But yeah, I think let's just talk a little bit about diet and acne as well, because food can definitely be a contributing factor and it's really important to look at. And I think another thing that I really ought to say about as well is touching the face. As I've been sitting here on this video, actually touching my face quite a lot. And actually I think we're all very prone to touching our face. I think it's really important. We have dirty hands, we touch the face a lot, you know, actually make sure that you don't do that. And another hint I can really give you is to change your pillowcase, or at least turn it over daily. So turn it over, get rid of it after 2 days, get another one. So because the bacteria are going to get onto your pillowcase, so it's really important that everything is kept really, really clean. So let's go back to that diet and acne link. Because obviously it's an area that's always been researched to get a better understanding with as well. But there are several studies now that actually show that diet can actually have a contributing factor to acne. So let's talk about foods that can actually lead to an increase in inflammation. And these are typically all the things that we know are bad for us anyway. So things like sugar, dairy products, in particular milk. I'll talk about a bit more about that in a minute. But refined carbohydrates such as white bread, pasta, white rice, red meats, foods which are high in fat, saturated fats, trans fats, things like that, they're obviously going to have that lead to that increase in acne production. And then why does that actually happen? Particularly with sugars and refined carbs, it's because they actually raise your blood sugar much more quickly. When this actually happens, it causes the body to release a hormone called insulin. So excess insulin can cause your oil glands to produce more oil. So which in turn is going to obviously increase your risk of acne. So really look at what you're eating in the way of those, as I say, those sugars, the refined carbs. They're going to be a big factor. But I think really I want to talk to you as well about milk. It's not shown so much with other dairy products actually. Milk seems to be the biggest contributing dairy product in this. And there's actually quite a number of studies that actually show the link between acne and dairy, particularly in teenagers. It's actually due to the metabolism of dairy, which actually elicits a biological response in some consumers, not everyone, and therefore can actually initiate an acne response. So, interestingly, there were some of the studies, they don't actually show much of a difference whether the milk is actually full fat or whether it's semi-skimmed or skimmed. It's just actually the dairy itself. So it shows that it's actually likely to be down to the presence of the hormones and bioactive molecules, which is causing these reactions. Milk contains components that relate to testosterone. And this can lead to an increase in the production of our oil in the skin. So yeah, I would definitely start to look at avoiding or at least taking milk out. And it's worth just trying these things and trying them for a few weeks. And I usually say to people, actually try things for about 12 weeks. Take it out of your diet for at least 12 weeks and see what happens. And then if necessary, sometimes you can start to try and reintroduce things and again, see what the responses are like. But yeah, if you're not seeing much of an improvement, then you know that it's probably not obviously going to be that. But you need to give things 12 weeks, and that's the same with any supplements that we prescribe you anyway. It takes about 3 months for things to get into the system and 3 months for things to get out of the system as well. So, I mean, and then let's talk about things that you should actually be eating or taking. I mean, there's lots and lots of supplements here and foods that you can actually eat. So we'll talk about sort of actually foods, because I'm always a great advocate of we are what we eat. So, it's not all about supplements. We can try and replace things, but we need to actually be having that healthy diet in the first place for everything to really, really work. Maria's just saying she solved a skin issue by getting a client swap from dairy yogurt to coconut yogurt. Oh, that's interesting. Phenomenal difference. Again, because obviously the milk within the yogurt itself, that's, thank you for that, Maria. That's a really, really interesting one, isn't it? So thank you. So what foods are believed to help your skin? The things like whole grain. I mean, most of us know what we should be eating, but we don't always eat it. So let's just give you the list of what we can actually think you should actually be eating when you've got acne. I mean, like I say, this isn't about other skin conditions, but obviously they all have a help with all of them. So you've got whole grains, you've got your unprocessed fruits and vegetables. Look at colours. Always look at colours as well. Your yellow and orange fruit and veg, carrots, apricots, sweet potatoes, tomatoes, blueberries, spinach. I love spinach. I put it in a smoothie every day. Whole grain bread, brown rice, quinoa, pumpkin seeds and nuts, beans, peas and lentils, and oily fish. It's always brilliant. Oily fish. Actually people think they might need to avoid oil and things like that, and actually don't necessarily avoid oil. And that's actually true when it can come to some skincare products. And again, this is where I do say see a skincare professional, because actually oil can dissolve oil. So don't avoid all oil in your skincare products at all, because actually it can really be a really great gentle way to cleanse the skin with an oily cleanser, because it can really help to dissolve some of the oil that's on the skin as well. You've got to remember that water will not dissolve oil. Oil will dissolve oil. So hopefully that helps a little bit. So, and then obviously in the way of supplements, we're looking at, again, omegas. They're really good because they actually help to decrease inflammation. So it's another really good reason to eat oily fish. Zinc, vitamins A and E, all those types of things. And one of the ones that we prescribe in our clinic is actually a patented supplement, which is a combination of vitamin A and DIM. And DIM is, I can't tell you actually, I can't remember quite exactly what it stands for because it's a really long name. But it actually is in broccoli and things like that. But you'd have to eat so much broccoli, and that's the thing with supplements. You would have to eat so much of these foods to actually get a really high quantity to actually help you with your skin conditions, which is why we do actually prescribe them alongside the healthy diet. Okay, so but it works phenomenally. That alongside your probiotics and actually cleansing that leaky gut that we were talking about earlier, getting that gut balance and getting the good bacteria into the gut is just going to make a lot of difference. So those would always be my first two ports of call when it comes to supplementation, would be vitamin A and DIM and your probiotic, and combined with a really good but simple skincare routine. It doesn't have to have 10 different products thrown at it. In fact, you know, sometimes less is more when it comes to these things. We need to actually just treat it gently and just cleanse it and, you know, look at this whole picture of the diet and our lifestyle. And actually exercise is another good one that I just like to mention, you know, while we're talking about lifestyle. My son's wife actually solved her acne completely by exercise. She was really prone to it, and once she started introducing regular exercise into her routine, it went, because it helps again with her hormones. So, you know, it was just, and she said it was phenomenal. And you probably if you look back on my Facebook page somewhere, you will see an interview that I did with Sylvia that actually explains about, you know, how exercise just was actually just a game changer for her as well. So I'm hoping that I've actually been reasonably informative tonight. As I say, it's been the first live that I've done for a little while, and yeah, it's been great to actually come on. If there's any, I'll just give a couple of minutes. If there is any, well, probably not a couple of minutes, I might be sitting here in silence in a second. But if anybody has got any questions, please actually do shout away now before I sort of sign off, and I'd love to answer them. But you can always come on and comment on this video if you're watching it later, and I will endeavour to check back and answer as many queries on this as I can. As I say, the whole of June has been Acne Awareness Month, which is why we've been doing that, doing this video. Some of my colleagues from the Skin Collaborative have been here to support tonight, and thank you guys for coming on. And go and check out the Skin Collaborative as well. And go and check the page out on Facebook and Instagram, because we are a collaborative of skin professionals who are here just to advise you about all things skin. That's what we're passionate about. That's what we love doing. So I'll give a little shout out for them as well whilst I'm here. And yeah, go and see what they're all about, because you'll get some really informative posts on there as well. So thank you so much, guys, for coming on tonight and watching my live. And I hope to actually see you either within the clinic or on Facebook. And I love you too, Maria. Thank you so much. And I'm going to see you on Monday, so I'm really excited about that as well. And yeah, hopefully we'll see you again soon. Thank you so much. Take care.